And then regarding use of probiotics, I'm wondering if you have products that you reach for based on your clinical experience versus products that you reach for because of evidence behind them.
Yeah, so the three that I'm aware of that there are peer-reviewed publications that look at some aspect of their utility are, I mentioned a couple studies using Visbiome, which was formerly called VSL. That's kind of your Cadillac of your probiotics. It's got the most diversity of bacteria as well as the largest actual amount of bacteria in a capsule. The others that there are some publications on are ProViable, and that's kind of an intermediate, I would say. There are more bacteria and a little more variety than some of the other options. And then the other is Fortiflora. And Fortiflora comes in a probiotic, it comes in a symbiotic, so with psyllium. And there are some publications looking at that particular probiotic as well. That's got less diversity and less numbers of bacteria. It's really easy to give. It's in a packet. I like to use it for some animals that just don't want to eat. It's like an appetite activator, I think. So I think those are all options. If you start with one and it's not working, don't rule out all probiotics. Maybe consider a different one. I think, animals are individual, the microbiomes are individual, so the probiotic that they respond to might also be individual. There's no studies that are looking at probiotics head to head, so we can't answer that question. And I've asked this question, if I have a kid that needs to have antibiotics and I ask, well, should I give them a probiotic? What should I do? Because a lot of times we're told, oh, just eat yogurt. But if the advice that I've gotten from physicians in terms of human health care and what probiotic to choose, their general rule of thumb is just pick one that has a lot of bacteria and a lot of diversity of bacteria. That's it. So if we use that rule of thumb, then you kind of have your spectrum in what's available in vet med, and you can go from there.
Yeah, well, I love what you say about if one doesn't work, try another, because I have personal experience with my own pet, for example, getting worse diarrhea using one of the products you mentioned and using a different one and it being like night and day.
Yeah, I think that's important. And the other thing too is that if you're using a really potent probiotic, again, that might be that's a lot of new bacteria in the population. And so it might take a few days to settle out. I guess that's what I'd say. So anytime we change something, we might not see immediate effects, and we might need to be a little bit patient and give it some time to see what's going to happen. And that's important communication to start with when you're talking to the owner about these things, because if the first day doesn't go well, they might not want to continue. But if they stuck it out, there might be more benefits. So for the chronic enteropathies, I think that's when we're often going for probiotics that have more bacteria, more diversity.
Great advice.